What EMDR does is replicates what the brain normally does when you are in REM sleep. We do EMDR using eye movements. Hi, this is Jim Brillon, and welcome to this YouTube channel where we talk about all things mental health. Today I'm going to be talking about EMDR, what EMDR is and how it can help people to resolve trauma. So EMDR is a specific type of trauma resolution therapy. EMDR stands for Eye Movement Desensitization and Reprocessing, which is a lengthy and really awful title for a trauma resolution therapy that is evidence-based and is actually tremendously helpful for a lot of people. EMDR is a therapy that was developed as a result of understanding how the brain processes memories and integrates memories. What EMDR does is help to reprocess memories that are traumatic memories, in a way that it doesn't erase memories, but it takes the traumatic aspect out of memories. What trauma is it's different for different people. What's traumatizing to one person is not going to be traumatizing to another person. But ultimately, trauma results when a disturbing incident happens that overwhelms the person's ability to cope with it in the moment. And when a traumatic memory becomes intrusive or people have flashbacks, that's when you really want to look at learning how to reprocess those memories. What EMDR does is it operates under a principle called adaptive information processing. That looks at the ways that memories are encoded, stored, and retrieved. And what happens is there are a couple of elements in the brain called the amygdala and the hippocampus that work together to integrate memories and store them into files so that we can retrieve them when we want to. What happens when trauma occurs is those memories have emotions linked to them, and they're not processed in a way that they just get filed away and they're left there. They kind of pop out, so to speak. That's what a flashback is. What EMDR does is replicates what the brain normally does when you are in REM sleep. REM sleep is rapid eye movement sleep. It's the deepest level of sleep. And when somebody is in REM sleep, their eyes move back and forth in their sockets. And we believe that what's happening at that time is your consciousness, your awareness is shifting back and forth between the left hemisphere of your brain and the right hemisphere of your brain. So what does that mean? Just in a very general way, the right hemisphere of our brain processes things like abstract ideas, big picture ideas, and emotion. And the left hemisphere of our brain processes things like linear thinking, problem solving, math, logic, and creating a narrative for things. When something is traumatic, those two parts of the brain have not integrated those memories efficiently. And what will happen is the emotional aspect of a memory will flash back, and the trauma happened in a way that that person couldn't make sense of it at the time. So what EMDR does is integrates those memories using the two hemispheres of the brain. And we do EMDR using eye movements or different forms of what we call bilateral stimulation. In the office, you might use tappers or buzzers that buzz bilaterally in your hands. When I'm doing EMDR with somebody in person or even on telehealth, and it's very effective on telehealth, we'll use eye movements. So we'd have a person sit still, hold their head still, and follow my fingers as they move across the screen, while they are holding in their memory some traumatic memory, allowing themselves to experience the feelings that they had, and also holding in their awareness some negative belief that they've developed about themselves because of that trauma. And we do the eye movements for a certain amount of time, and then I'll stop and I'll ask the person, what are you noticing right now? And what happens is, over time, the brain integrates those memories, and it integrates the emotional aspect of it with the narrative. So the brain is actually able to make sense of what happened when the trauma occurred. And what happens is it's no longer a traumatic memory. People make sense of it, they can understand what happened. A lot of times they realize that it wasn't my fault, and they reprocess those memories so that they're not intrusive any longer. EMDR, when I first heard about it many years ago, I was very skeptical about it, and then I read research, and it's now one of the most researched forms of trauma resolution therapy, and it's also one of the main 3 ways that the Veterans Administration works with vets coming back from a combat situation. So if you're interested in EMDR, I hope this is kind of an initial primer as far as letting you know how it works. I'm trained in EMDR and I use it successfully with a lot of clients. If you're in California and you want to reach out to me, you can contact me at the information in the bio. And please, as always, if you like these videos, like and subscribe, sign up for notifications, leave a comment, let me know what you think, what you'd like to hear about, and I look forward to sharing more info with you later. Take care.